Hello guys, welcome to Homeo Health Care. Today we are going to discuss on the topic gout. So, what is it? It is an inflammatory condition in which there is the deposition of the monosodium urate crystals. But where? It will be in or around the synovial joints like elbow joint, wrist joint, knee joint, etc. And what is the mechanism behind this gout formation of these uric acid crystals? It is like due to the imbalance, failure of maintaining the balance between the endogenous synthesis and elimination either from the kidney or the gut of these crystals, these substances. As endogenous means when it forms in the body itself, then it is termed as the endogenous. So, from protein, when it gets metabolized, it forms ammonia. After formation of this ammonia, there will be the formation of urea after metabolism of this ammonia. When this urea gets degraded, after that uric acid gets formed, and the kidney and the gut of human body has a physiological function of elimination, excreting out this uric acid. But when there will be the excess synthesis endogenously and decline in the elimination, this condition gives a rise. After that, this certain mechanism has happened. What clinical features we all are going to see in the patient who is suffering from the gout? First and most, the onset of condition. The onset will be here rapid. As in the few previous videos, we have discussed that the onset of pain of lumbar spondylosis is gradual. The symptoms develop slowly. For cervical spondylosis too, the symptoms develop gradually, slowly, insidiously. Also, in the osteoarthritis knee, the conditions are such gradual only. But when it is the pain in the knee or the elbow or the metatarsophalangeal joint, ankle joint, what kind of pain will be there? It will first of all the rapid onset. If there is a rapid onset of pain, thinking to the gout is the right direction. After that, this pain gets aggravated after waking up from the sleep, from in the morning. These are the aggravating modalities for the gout condition. Along with this, when there is the attack of this pain, there will be the swelling. There will be the erythema. That means redness. And what can be there? Fever, as it is an inflammatory condition. So, fever will be there. And malaise, feeling of fatigue, थकान लगना, कमजोरी महसूस होना, ये सारी चीजें एक गाउट के पेशेंट में दिखते हैं. त्यानंतर जेव्हा हा अटॅक चालला जातो, हे सिम्पटम्स चालले जातात, तर मग काय प्रेझेंटेशन्स येतात? देअर विल बी द प्रोरायटिस, दॅट मीन्स itching on the skin. When this symptom gets disappear, the itching on the skin starts there. So again, it can be a concomitant symptom for a homeopath. Then what further? What differential diagnosis will come here? There can be reactive arthritis, can show some similar presentations like gout. Infective cellulitis can show some presentations like gout. But always no. Then, what are the risk factor or triggering factor in which the gout condition can be mostly seen? It can be seen in the alcoholic patient too, but not in all alcoholic patients or all the patients who are suffering from the gout are alcoholic. It is one of the triggering factor. Common sites which gets affected by this gout. First and most is the first metatarsophalangeal joint, that is our अंगुठा, आपला पायाचा अंगठा, big toe. First and most, there will be the deposition, most common site. After that, there can be ankle joint, knee joint, in the midfoot, in the elbow joint, wrist joint, or any other small joints can be there. Here, this gout condition can be seen. What complications get arise if the gout is not treated? There can be the formation of renal stones. Also, the interstitial nephritis. That means mostly complication comes on the kidney, as it also has a physiological, pathophysiological relation with kidneys, because this uric acids gets eliminated. 2/3 part of uric acids gets eliminated from the kidney. So this was about the complications gets arising there. Now, what will be the mathematic understanding for the gout? Mostly, as it is the accumulation, formation, deposition, construction, so it mostly direct towards the psychosis miasm. As we all know, in psychosis miasm, there will be the deposition, accumulation, construction. Here, these crystals are getting formed because of first excess of uric acids gets accumulate. They form these crystals. After that, they go and deposits. So, this comes under the psychosis miasm, as there is the construction, accumulation, infiltration in the psychosis miasm. So there can be a clear picture of psychosis miasm in the patient of the gout. So now what about its treatment part? The first and most, in homeopathy, after taking a case, going through detailing on that, analyzing the case, processing the case, what remedy comes up that suits to the patient, and After a course of treatment, he gets a relief from his condition. He will not suffer this intensity of pain of the gout. जब कोई पेशेंट गाउट के प्रेजेंटेशंस लेके आता है, उसकी जब अच्छी सी केस ली जाती है, उसके बाद में केस लेने के बाद कौन सी रेमेडी ऊपर आती है जो पेशेंट को एडमिनिस्टर करने के बाद एक कोर्स ऑफ ट्रीटमेंट में उसे अच्छे से आराम गिरता है। और एक बार उसे आराम गिर जाए तो उसी इंटेंसिटी में पेन आने का बहुत कम चांसेस होता है। एखादा व्यक्ती ज्याला गाउट आहे, त्याचे युरिक ऍसिड लेवल्स वाढून आहे, ESR वाढून आहे, CRP सी रिएक्टिव्ह प्रोटीन बॉडीतले वाढलेले आहे, तो पेशंट आला, त्याच्यानंतर त्याची डिटेल केस केसवर वर्कआउट केलं, त्यानंतर कोणतं औषध वर निघून आलं, जे औषध त्याला दिल्यावर त्याला चांगल्यांनी आराम पडेल एका कोर्स ऑफ ट्रीटमेंट मध्ये, आणि एकदा त्याला आराम पडला तर तो फारसा त्रास त्याला परत येत नाही. As we says, we treat the man in disease, not the only disease in man. आजारात आलेल्या व्यक्तीसाठी औषध देण्यात येतं, rather than फक्त आणि फक्त त्याच्या आजारावर औषध देण्याऐवजी. So, if you like this video, subscribe to my channel. Thank you.